Welcome to another episode of What Did the Patients Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hello and welcome back to another episode of What Did the Patients Say? This is our patient interview series. With me today is Kim. She's my patient. I'm Dr. Lynn Carlson at Carolina Functional Neurology Center, and she's going to share a little bit about her experience of going through treatment here at Carolina Functional Neurology Center. Thank you for joining us, Kim.
Thank you for having me.
So to start off, can you share with us what symptoms you were experiencing initially and when did these symptoms start?
So initially, my injury happened 3 years ago. I sustained a head injury and have since been diagnosed with a TBI and several other diagnoses ranging from visual issues, autonomic dysfunction, cognitive issues, TMJ, and the list goes on. Over the first week after my accident, I was confused and not able to think clearly, having visual, speech, cognitive, and sensory issues. I remember saying things like I was off, but not knowing how to describe them, and saying I felt like I was in Alice in Wonderland, and saying things were wonky. The grocery store was awful and I wanted to cry as that was a horrible experience. I experienced a wide range of symptoms from anxiety or frustration to sleep issues, tremors, blood pressure issues, muscle tension, cervical compression, weight gain, cognitive issues, respiratory issues, exercise intolerance, visual issues, fatigue, and sensory issues.
Thank you for sharing, Kim. I appreciate it. I know this has been a journey for you. What type of care did you receive prior to coming to us here at Carolina Functional Neurology Center?
I would like to add something to what you had said before. I'm sorry. Some of my symptoms started immediately, but some of them grew worse as the time went on. And it was like being hit by an 8-10-wheeler. And with a TBI, your brain is like a motherboard to all your other operating systems. And when something is wrong with your motherboard, the other systems don't function correctly. And there is no backup system to tell you what is wrong, meaning your brain can't tell your brain that something's wrong with your brain or what part is damaged. So over time, I've slowly chipped away at figuring out what's wrong. Like I don't remember when my tremor first happened, but I remember when I first became aware of it. And I remember when the blood pressure first became brought to my attention. So sorry. So even I'm still, even 3 years after the fact, becoming aware of things affected by the TBI. And some of those things you have found for me, Dr. Carlson. And I think your next question was, what type of care did I receive, right?
Correct. And thank you for that analogy. I appreciate that and for your experience. And I was asking what type of care you did receive prior to seeing us here at Carolina Functional Neurology Center.
So I've received a lot of care before coming to CFNC. I've seen over 20 professionals, whether it was primary care or neurologist or oral medicine, a psychiatrist, ENT, therapies like speech or vision, physical or occupational therapies. But I've been to over 20 before coming to CFNC.
Great. That's great. I mean, I'm so glad you did find us. How did you find us here?
So finding CFNC has been a full circle moment for me, because I first became aware of CFNC listening to one of their podcasts about dysautonomia. That was like the first year into my injury. But things just clicked for me. And at the time, I was in the workers' comp process and unable to come. And then while I've been seeking care on my own, my attending psychiatrist in Raleigh referred me to you guys due to geographical reasons and CFNC having multiple types of services and therapies under one roof. So thankfully the timing was right, because if I had come in that first year, you wouldn't have been there. So everything kind of just worked out.
That's great. And just to recap, when we started working together, we were originally doing that more intensive focus. We were working together twice a week for about 6 weeks. And then as you progressed, we were able to go down to once a week treatments for another month. And now we're at the point where we're able to stretch that out even further. So you've been doing wonderfully. And again, it's so inspiring to see all the accomplishments you made. So please tell us, if you will, what was your experience here at CFNC as a patient?
So I think that CFNC works on the framework or the foundation to identify and understand the root causes of my deficits, my symptoms, and to address my brain injury with a plan of action that is revolving and changing based on my ability. It's much like building a house. Without a good, stable foundation, the house is going to crumble. And for my experiences elsewhere, they're trying to work from the top, and it always crumbles because they're never addressing the foundation. So I wasn't ever having progress. And they were treating patients like a cookie cutter. Everything was just always the same approach and this generalized approach, and not addressing individual needs. And that's just what kept happening over and over. But you worked to find a root problem at the foundation and a way to get in to address what my needs were and build up from that point. And you've been unlike any other doctor I've went to. I come in with a list of symptoms or things that are going on, and you look at that as a whole and you pick away at them, while working on the TBI issues, like you work on the dysautonomia or the vestibular systems. You've helped with my gait and my speech and the ability to breathe better. You've looked at the whole body and listened to what I was saying, instead of going to a neurologist who just looked at migraines. You were focused on the whole picture. When you identified a problem like my vision or heart issues, you also addressed them, the problems with me, and let me know what you were going to do. And you addressed it with my other doctors, and like getting supplemental vision therapy or being seen by a cardiologist. You know, I ask lots of questions, but you're always willing to answer them, to explain what's going on with me or why you're doing a specific technique. And the other staff, as well as you, are always accommodating, whether it's turning off lights due to a sensory issue, or even getting another client like a fan to stay cool because of an autonomic issue. And I would just like to add that coming there from the first day, you did an autonomic test where it was this like lay down and stand up thing, but you said, I won't let you fall and I got you. And those words meant a lot to me because my body was going through all these crazy symptoms, and doctors before had just said, oh, you have dysautonomia, but nobody had explained why my body was doing what it was doing. And like, it made me have this sense of comfort and trust and a sense of being heard. But you also get excited, like if we have improvement or progress. So like, that's a lot different than just going to a regular, other doctor's office. And everybody's always friendly and willing to answer any questions you may have. It doesn't even have to be your own doctor or people working with you. Sorry. Okay, I'm done.
Thank you for that. No, it's been wonderful to work with you. And I was just asking, based on when we first started working together, it's only been a couple of months in your journey of health recovery. How do you feel you are today versus when we started working together?
So I've had a vast improvement from when I started. I do have memory issues, and I don't remember like everything from that day I first came in, but I can say overall, like, I feel better. We've been working a lot with my vision and like my gait and like my breathing and posture have been, have had a big improvement. And my speech has gotten better. But overall, I'm much better than when I came in. And I know I won't be back to like pre-injury, but the goal is to strive to be the best version of me post-injury I can be. And I can say that in my journey over the last 3 years, I have not had as much progress in the 3 years that I have since I started going to CFNC.
That's great. Well, thank you so much. It's been wonderful talking with you, Kim, and again, a pleasure working with you. And for anyone listening, if you have any questions, feel free to comment, reach out to us, check out our website at carolinafnc.com for additional information on our treatment programs. And Kim, I want to thank you so much for sharing your story, and I look forward to seeing you again soon. Take care, everyone.
Thank you.